Колеги, дякую всім, хто прийшов.
Dear colleagues, thank you for coming. Thank you for watching us online. The topic of current press conference is first outcomes of the procurement of medicines through international organizations. We have Igor Perehinets, Deputy Minister of Health of Ukraine, Yegor, Soboliev, Member of Parliament, Samopomich, pension, Vitaliy, Shabunin, Head of the Center for Combating Corruption, and Olha Stefanyshyna, Executive Director of the Charitable Foundations of Ukraine. Dear colleagues, good afternoon, dear colleagues. Today we launch our second phase, informing the public about first steps in drug procurement via international organizations. Today we won't discuss the prices. We will, because the contracts are not signed yet, although the procedure is over. And we will discuss the main trends, the main outputs. You might know that last year we allocated more than 2 billion hryvnia for procurement of drugs from international organizations. This was more than a half of the public money allocated for these purposes, and as of today, WHO and other international and UN International Fund and UNICEF also they continue concluding contracts for procurement of those drugs. As soon as the contracts are signed, we will be able to publicize them. As for the tenders which are over, and the results reported by international organizations prove that they appeared able to save a lot of money and to purchase much more medicines for the same amount of money. As, for example, as to tuberculosis, they managed to save 30% amount of money against the data from 2014, and this is all despite the inflation. In 2014, they would spend not $7 million for purchasing the same amount of drugs for tuberculosis, but $12 million. As for the drugs against oncology and hemo-oncology, we may say that around 66% of money were saved, and additional drugs will be purchased. As for UNICEF, the necessary vaccines which are needed for Ukraine for prevention of infectious children's diseases, they will be purchased and supplied to Ukraine this year. Also, we made external references to the countries which use the same types of medicines. We compared prices with Russia, Czech Republic, etc. The Moldova, Slovak Republic, Czech Republic, Bulgaria. We could say that the medicines which were purchased from Russian Federation are the cheapest. Also, we purchase sufficient number of medicines for prevention of and support of HIV/AIDS infection. As for ratio between national producers and foreign producers, the ratio is almost 50-50. The Ministry of Health, supported by the Cabinet of Ministers, paid 4 billion hryvnia to international organizations for procurement of drugs. From today, we will inform you about compliance with those contracts. We will provide all necessary technical information. I would like to use this opportunity to thank to those people who advocated for changing the main procurement principles. These are the patients NGOs and anti-corruption NGOs. I believe that this first step done by the Ministry of Health would strengthen our confidence in this way of procurement and will allow us to act more patient-oriented. And I'm very grateful to all our partners in this area. Thank you for cooperation with this. I would like to invite Mr. Yegor Soboliev. I would like to mutually thank to Ihor. Here you see very successful coalition. Here you see those people who, despite all the statements that you won't do it, did it and ruined one of the most terrible and one of the most, so to say, successful schemes of drugs procurement, which allowed public officials to steal a lot of money. I may recollect one of the first journalist investigations during violations of procurement of Tamiflu at the price for more than 4 times higher that it cost. Up to 40% of public money allocated for procurement of drugs was stolen during all that years via that scheme. And now I would like to congratulate all of us with the ruination of this scheme, and I believe that unless we have good competition in our health care organization, unless the money will follow the patients, unless there are clear rules of the game, we would have the same vague situation as we had with that we had with procurement of drugs. These days, I would recommend the Minister of Health to take this big energy that we applied here to procurement of drugs via international organizations and streamline it to the reforming of the rest of the healthcare system. By the way, that big difference between procurement price this year and last year shows how much was stolen by those corrupt people who were responsible for public procurement last year. And the second thing, we continue our discussions with the international partners that are under condition when corruption is still flourishing in the country, the transfer of procurement into the hands of international organizations could be the only way out. I'm happy to congratulate you, and with this I would like to give the floor to NGOs, to civil society organizations which played leading role in this first step. Good afternoon, dear friends. We are thirsty for victories for the last 2 days. We would like to give you the handouts with the exact figures today, but we had not enough time to produce them. And because in those handouts we will be able to show you in written form that this year international organizations purchased the same drugs from the same companies as Ukraine used to procure during the last several years, but for much lesser prices. And this obviously proves how much money was stolen. Especially, we should keep in mind that all those drugs were anti-TB, anti-AIDS, anti-hepatitis, which are of considerable threat for the public health. And I would like to point out to another aspect. Quite often those who contributed to that try to counteract to the procurement via international organizations. They manipulate with the formulas, dosages, packages, etc. They will try to do this once again. Please do not allow to deceive you. Mr. Perehinets, on behalf of the Ministry of Health, will take care about the medical side, quality side of this matter. And this is an obvious reform, obviously implemented reform, and some politicians may try to kill it. I have heard that some MPs expressed their doubts, so I ask you to wait for publication of our figures. Good afternoon, dear friends. I'm representing the Patients of Ukraine Charity Foundation. Our association unites more than 120 patients organizations around Ukraine. I would like to begin with one life example. There is a tradition when an ill child is taken into the surgery room to the operation. The shoes of this child are left on the outer side of the door of reanimation chamber. And I wish to say that such shoes every day remain at the outer side of the door of surgery rooms, and there are thousands of them every day in our country. Last autumn, we brought similar shoes to the Prime Minister, showed them to him and asked to facilitate supplies of vitally necessary drugs for children. For example, Nona has a terrible disease. She has hemophilia, and together with us, she went to the Prime Minister, and jointly we came across the idea of purchasing drugs via international organizations. When Igor mentioned today figures, these are just percentage for you, but for us this means that 60% of children, 60% of children will be able to put on these shoes again after surgery and after the illness. And once again, and this was a big achievement of Yegor, Igor, and Vitaliy. And unfortunately, Igor was the only one person who promoted this reform of procurement of drugs from international organizations. We are very grateful to the Ministry of Health, and we're happy that the tenders for 2016 will be allowed very soon, and this would allow us not to have interruptions, because the last year there was a big delay with supplies of necessary drugs. For example, some medicines started to arrive last summer instead of February, while anti-AIDS drugs have not arrived even today.
And tell us, please, what will be with the funds that were saved in these procedures and these tenders. These funds will be redirected for buying some medicines. And after we understand what is our savings, and the organizations will inform us on this, and we will gather a meeting, and then we will be will ask these organizations to redistribute these funds for buying some vaccines or medicines. Who is the next one? A comment. And how is our market of medicines covered by this procurement? In Ukraine, no program was financed 100% previously. So for different reasons. First, we are provided with a budget, then it is distributed throughout the programs. And for example, children's hemophilia in 2015 was financed for 70%, and and each program has a budget funds in the framework of which we can correlate and we can save some funds. And for example, in oncology sphere, we can buy additional medicines for oncology and not for other. So we can redirect some funds for other medicines, maybe not clearly proportional, but we should first establish what medicines are of importance and what is the urgency of these purchases. Good afternoon, Alexander Mamai, Stop Corruption Program. The question is about Indar plant. First, about this. Do they buy for insulins for state money and from this plant? And in 2013, the directors of this plant they stole about 100,000 hryvnias. Do they conduct investigation in this case? And how can we turn this money back to the state? It's not the matter of this press conference, but still, I'm involved in some processes, and then we have some distribution of responsibilities as to insulins. They are bought by regional programs. That's why we have information on this, and we made some analysis on this, on the cost and financing and what medicines are needed the most. And as to the processes in this enterprise, maybe it should be investigated, but I don't have information on this. Do you have some other questions or comments? As to procurement, I'm speaking about drugstores. If, for example, they send a patient to a hospital, if hospital asks a patient to buy some medicine in the drugstore, is this legal? And what are the consequences of this? It is directly related to the question how the ministry controls the prices in the drugstore. So we can influence only by transparent systems of creating and taking decisions, but as to the separate drugstores, it should be defined by law, but there should be some prescriptions written by doctors, but we know that at the grassroots level there's such a practice, and it should be decided in each case separately. And it's difficult to solve this issue in one sector because we have budgets here in this, and they are interested in spending money and not providing services properly. And draft law is in the parliament, and we should start with this. And as my colleague said, the business and the management and the responsibility for the effectiveness of using funds, we should first resolve this problem. Otherwise, we can't solve these problems. And some some drugstores that are, for example, placed in the hospitals, the prices in these drugstores, some medicines or hygienic means, they are 25% higher than in other drugstores of the city. So this is a business of chief doctors, and they get this 25%. And who these drugstores belong to? And so these maybe the owners, maybe their children or their wives. We had a story with the minister who also abused his responsibilities, and this is a matter of criminal or administrative responsibility. If you don't have any other questions or comments, we will end press conference. Thank you very much. Until the next time, goodbye.
Колеги,
Our working day is over.